What are consequences for boundary violations? Have you ever wondered what happens when personal boundaries are crossed, especially in the context of supporting a loved one with addiction? Understanding the consequences of boundary violations can help families navigate these challenging situations. When boundaries are ignored, it can lead to serious emotional and relational issues. First, let's talk about the emotional and mental health impact. Family members may feel a whirlwind of emotions like guilt, shame, fear, anger, and mistrust. This emotional turmoil can lead to feelings of depression and isolation. It can also create confusion about their identity and role within the family. Next, boundary violations can strain relationships. When trust is broken, it can damage or even sever connections. For example, if an addicted loved one steals money or comes home intoxicated, it can create an unsafe environment. This can lead to a loss of trust and safety within the family. To protect their own mental and emotional health, family members often need to take protective actions. This might mean cutting off financial support, limiting communication, or even involving law enforcement. These actions are not meant to punish but to hold the addicted individual accountable and prevent enabling behaviors. Now, let's look at how these boundary violations can impact recovery. Consistently enforcing boundaries can actually support recovery. It encourages the addicted individual to take responsibility for their actions. On the flip side, failing to enforce boundaries can enable addiction and prolong dysfunction within the family. There are also professional and clinical consequences to consider. Treatment providers who violate boundaries with clients can face serious repercussions. Clients may experience emotional distress, including feelings of shame and mistrust. Providers themselves may suffer from burnout and strained workplace relationships. In extreme cases, they could lose their job or professional license. So, how can families effectively set and maintain boundaries? It starts with clearly defining and communicating what those boundaries are. Specify acceptable and unacceptable behaviors. For instance, you might decide not to allow intoxicated individuals into your home or refuse financial assistance when it is misused. Using compassionate yet firm communication is key. This balances empathy with accountability, making it clear that while you care, certain behaviors are unacceptable. Seeking external support, such as counseling or support groups, can also help families manage the emotional impact of boundary violations. Setting boundaries is not just about protecting yourself. It is also a vital part of supporting recovery for your loved one. By understanding the consequences of boundary violations, families can create a healthier environment for everyone involved.